Good morning, and now we will talk about how to think in the 3D. The goal is to train our brain to look at 3D ultrasound information from different points of view, like you can see in this photography from Tel Aviv. This is the multiplanar view. You can see here the coordinate system in which the three planes are perpendicular to one another. The blue plane is the A plane, it's like we just do the 2D ultrasound. The green plane is perpendicular to the blue plane, like we open a book or a door. And this is the plane that we can get also by 2D by rotating the transducer 90 degrees. The green plane is the plane that we cannot detect while rotating the transducer, and if we want to see it with a 2D, we have to change the position of our hand. All three planes, the orthogonal planes, intersect at one point here, which is the dot of interest. Now you can see here all the three planes. The three orthogonal planes are laid out so we can see the information in front of us, although it is taken from three perpendicular angles. And in this case, the point of interest, the dot of interest, is in the center, but it's not necessarily like this. So let's see how it works with a volume. Here you can see the fetal face. This is the coronal plane of the fetal face, the sagittal, and the axial plane. As you can see here, the coordinate system. The dot here is in between the fetal eyes, and it is the same place in all three planes. So I just mark it. So this is the blue, look at the blue plane. This is the x-axis and y-axis. You can see that the blue plane has x-axis and y-axis. Now let's turn 90 degrees to the green plane. The green plane, here it is, you can see it here, has the same y-axis as the A plane. They share the same y-axis, but the green plane has the z-axis here. So this is the z-axis, z-axis. Now look at the C plane. This is the C plane, the A, B, and C. Look at the C plane. The C plane has the same x-axis as the A plane. Okay, look here. They share the same x-axis, and it has the z-axis. Here, this is the z-axis of the A plane. Now we can see the clip. And the first tool that we are going to learn is how to move the dot of interest. And when we move this dot, we don't have only the coordinate system, we have information of a volume. So when we grab the dot, the information changes. And I want you to see how it works. So we grab the dot in the B plane to the anterior part of the fetal face. And I want you to look at the A plane and at the C plane and to see how the other planes changed, because now we take different coronal planes along this road. This plane does not change a lot if I stay at the same level and I'm not going down. So now I'm going back. So this was changed. Now I'm going down. I want to demonstrate other organs. You can see the palate here. So we are on the palate in all the three planes, and you can see it very nicely here. Then we go down to the tongue. Look at the tongue here and here, and to the mandible down. So this is a very important tool of movement of the center of interest or the dot of interest. Another tool that we have is rotation on the X, Y, and Z axis. if we rotate this plane on the y-axis or z-axis or any axis, you will see that all the other planes rotate with it. Everything that we do on one plane influences the other planes, and I want you to look at it. So now we rotate the face on the x-axis. The x-axis is common to the A and C plane, and you see that the B plane rotated on the z-axis. Now we rotate the y-axis, and now the z-axis is here. Both rotate on the y-axis. And now we can see the rotation of the z-axis. So those two rotated on the z-axis. So rotation of the z-axis is like a clockwise and anti-clockwise rotation, while rotation on the x-axis is like the fetus nodding the head and say yes. And rotation on the y-axis is like the fetus say no, shaking the head. I would like to share with you how rotating the image and moving the dot of interest assist in daily practice. And this is an example of the aortic arch. This is axial plane of the fetal chest at the level of the three vessels trachea view. You can see the aorta, the aortic arch, the ductal arch here, the superior vena cava, and the trachea. If we want to see in the B plane the sagittal plane of the aortic arch, we have to put the dot of interest in the aorta, wherever you like, and we have to align the ascending and descending aorta along the y-axis. In this way, we can see the aortic arch here, as you can see very nicely. Now we want to demonstrate the ductal arch. In order to demonstrate the ductal arch, you have to grab the dot to put it at the pulmonary artery, the main pulmonary artery. But if we just do this, then the y-axis is going to be here, and the aorta is not in the image. So we also have to rotate the image a little bit, so the aorta and the pulmonary artery are at the same plane. And you can see it here. We grab the dot and we put it at the same plane, and you can see the ductal arch. At the end of my talk, we will do it together with a volume. Now because now I just want you to understand how to think and what to want to do. But later we will have a practical work together. Then we want to look at the superior vena cava. So we have to grab the dot to the superior vena cava here. And that's what we just did. And you can see the right atrium, you can see here the superior vena cava and the inferior vena cava. And if you want to look at the trachea, just grab the dot to the trachea and you get the trachea right here. Now, in order to understand what's happened when you rotate one image, how it influences the other image, I want you to think about this ballerina rotating on point. Here I'm giving you a blank slate so you can use your imagination. You will need this ability to imagine in your daily work. So let's see how it works. So now I want you to think about the ballerina rotating, and this is like rotation on the y-axis, as you can see it here. So if we look in front like the A plane, we can see her coronal plane or sagittal plane. So if we rotate her, you will see here and here, coronal and sagittal. When it's coronal here, it will be sagittal here, because the B plane is like we look at her from the side. So if we see in front the coronal, then the side is the sagittal. Now the C-plane is like if we look at her from below or from above. And what we see is only the axial plane, but rotating clockwise or anti-clockwise rotation. So the y-axis is like the ballerina. Now the x-axis, you can think of a gymnast swinging on a bar. If we look at her in front with the A-plane, we can see the axial and coronal plane when she rotates. And also if you look from below, from the floor or from above, we will see the axial or coronal plane. But if we look from the B-plane is from the side, then we see only her sagittal plane rotating clockwise or anti-clockwise. So this circle here is the Z-axis rotation. Okay, if we look at her from this side. And if we want to understand what's happened when we do the Z-axis rotation, just think about a gymnast does a cartwheel. So if we look at her from the A-plane, we see only her coronal plane rotating. But if we look from this side, we will see her axial plane or sagittal plane. And when we look from below, we will see also or axial or sagittal planes. Now, when you have this knowledge, I want you to look again at the volume of the rotation of the head. So the x-axis rotation, you see that both are x-axis rotation, and here is the z-score. It's like the fetus say yes. And now the fetus move on the y-axis. I could say no. And now you can see the z-axis rotation. Okay, now we have tools to work. We learn how to move the dot and how to rotate the image. And we're going to use those tools to align our volume or our images. This volume, you can see this volume was taken from a normal fetus, but it was taken obliquely on purpose, of course. And you can see the heart and you can see the stomach, and this fetus does not have a diaphragmatic hernia. So this image is oblique. And we want to align it according to an organ that is straight or symmetric. So for the heart, we can choose the aorta. For the face, we can choose the eyes, and I will show you this later. We have to coordinate the alignment in all three planes. It's not enough to align the image in one plane, because you will see that it might look aligned, but in the other planes, it will be oblique. And it's much more easier to work when you look at three planes all the time. So we will grab the dot to the aorta. Then we look at the other planes to see if we can recognize the aorta, the descending aorta, in one of the planes. And most probably it will be easier to see it here at the B plane. Then we will straight the aorta according to the x-axis here. And then we have to also straight the aorta in this plane. Now you know what to expect, and I want you to look. We grab the dot to the descending aorta here. Now we rotate the volume and we align the aorta here, and then we align the aorta here. We just do the Z rotation. Okay, now the information is aligned, and we just grab the dot upper to the upper part, and here you can see a very nice four-chamber view of the fetus. But this is not always the image that we want. In this case, we want to look at the interventricular septum. So in this case, we align the image according to the interventricular septum. So we aligned it here on the y-axis. We aligned it also here. And so in the B-plane, you can see the whole interventricular septum in front of you. When you see only the A-plane, you might think that you are in the middle of the heart. But looking here, look, the dot is not in the middle of the heart, it's just in the posterior aspect of the heart. So you can see here the coronary sinus very well. So practically, you can see here a 2D image with a VSD. And we can use what we just learned to look at the VSD from other aspects. So this is the same fetus with the VSD. We align the interventricular septum here and here. So this is the short axis of the heart. And on the B plane, you can see the interventricular septum here. And you can see the length of this VSD, which is longer than just a dot here at the A plane. But you can also want to look at other things. Here we want to look at the AV valve. So we align the AV valves according to this y-axis. So you can look at this short axis of the heart and see the AV valve, the tricuspid valve and the mitral valve. You might expect to see here the interventricular septum, that this organ is oblique now. So what we just get here is part of the septum and part of the left ventricle. Now let's go to the brain. You can see now a sagittal image from the brain, and this is only the A plane of the image. Look at it, and what do you think about this plane? Just think to yourself, because I cannot see you or hear you. Take a moment to look at this plane and think about it. And now I'm going to show you the multiplanar image of this plane. So now you can see the multiplanar image. I just emphasize the dot of interest so you can see it because it's very small. Have you changed your mind? Okay, let's look at it together. This is the sagittal view, the coronal view, and the axial view. At the coronal view, you can see the midline, you can see the corpus callosum here, you can see the cavum septum pellucidum very nicely. You don't see this lateral ventricle because it's small, and you can see that the dot of interest is inside a lateral ventricle. So what you see here, this is a lateral ventricle and this is a lateral ventricle. If we want to see the corpus callosum, we have to grab the dot and to put it on the corpus callosum. So let's do it. Now we put the dot on the corpus callosum and you get the corpus callosum very nicely here and here. Just a minute. So the issue is location, location, location. You use the 3D information in order to be in order to work with aligned images, not to be oblique, and to know exactly where you are in the volume, in the space. What do you think about this palette? Isn't it a very nice palette? This is again only the A plane or from a volume. Now I will show you the multi-slice, multiplanar view. And I want to ask you, have you changed your mind? Again, I emphasize the dot of interest because it's very small. So this is a sagittal plane of the fetal face. So you can see that the dot is not on the palate, it's on the mandible. Okay, in order to see the palate, we have to grab the dot to this area, to the mandible. So let's do that. Now we grab the dot, and this is the mandible. It doesn't look so nice usually. So again, location is extremely important. So look at the mandible and at the maxilla with the palate. They don't look the same, but you might be confused if you don't know your location. It's the most difficult to know that in abnormal cases. Now the next thing is the tomographic ultrasound imaging. We look at the 2D images till now as perpendicular to each other, but we can also look at the images as parallel to each other. And like you can see here in this sushi of Nemo, here you can see parallel slices of the sagittal plane of the brain. The image here is not sagittal, it's coronal, and this is the image of attribution, because we want to know exactly where each slice was taken from. The asterisk is usually the midline here, but you can change that. So we can cut those slices from one lateral ventricle through the center of the brain, the midline, to the other lateral ventricle. So you see one lateral ventricle, then continue to the corpus callosum, then continue to the other lateral ventricle. So you have the whole information in one screen. You can change the distance between the slices or the number of slices that you see. And this is another example, and you can see here the fetal face. This is a sagittal plane. Again, this is the image of attribution, and you can just put your lines from the eyes to the mandible, so you can see the orbits and the lens, and then you go down, 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 and you see the palate very nicely, the tongue, and the mandible. You can do the tomographic imaging to all three planes. You can choose whether it will be an A plane, B plane, or C plane. But first you have to work with the multiplanar and to align your image and to put a dot of interest really at the place that you want to examine. So here I didn't include the eyes because I just want to concentrate in this area of the mouth. So this is the A plane. You can see the palate very nicely here and the mandible. This is the B plane. So you can see one eye here, the other here, and this is the midline, and you can see the palate. And this is the C plane, the coronal plane. You can see both eyes, you can see the metopic suture, whatever you like. You can move it, you can change it, you can see both ears now, because this is a small baby. And this is a case, this is an old case of right diaphragmatic hernia. You can see here that the image of attribution is an axial plane at the level of the stomach and liver of the fetus. And let's go together on the coronal plane from anterior to posterior. So the anterior image, you can see the sternum, you can see the ribs, and you can see the diaphragm here. You go slightly back to this image. So this image is this line. Now go to the second line, this image. You can see the lung, you can see the liver, you can see the diaphragm here. Then you go more posterior, you can see the lung, liver, the diaphragm, but here you're not sure what you see. So when you go back and back, you see that the liver just entered the thoracic cavity. So you can see it here and here. You can't see the line of the diaphragm. So You know, it's very hard to detect the right diaphragmatic hernia, not as the left, which is much more easier. And in this case, the tomographic imaging really assists us in making the correct diagnosis. So you can decide what will be the distance between the slices and how many slices that you want to include. The last thing I want to talk about is the VCI. This is the volume contrast imaging or fixed size. We can look at the images whether they are tomographic image, whether they are a static information or dynamic information like a 4D. We can look at them instead of as 2D images. We can look at them as a very, very thin volume. We can decide how thin the volume is going to be, whether it's going to be 1 millimeter or you're going to see 20 millimeter or any number in between. But you have to not to include information that you don't want to see in the volume. This is just a volume of the fetal spine. You can see the sagittal, axial and coronal plane, and you can see that the coronal plane is not so clear. Now we just add to this plane static VCI, static because it is post-processing, it's 3D, the dynamic is 4D. So let's add the VCI and look at the image. It is much more nicer here and here, but look at the C-plane. And I will just put you the C-plane information without the VCI and with the VCI. Okay, the image here is a collection of information taken from a number of slices, which gives you much more depth. So, but you have to keep the depth with the information that you need. Don't include an area that are not interesting for you now, because then the image will not be so clear. Another example of using static VCI is the fetal vermis. This is a sagittal view of the vermis from a volume without VCI, and look how much difference you can see with the VCI. You can see the lobulation of the vermis very nice here. But the VCI can be also used as a dynamic examination. You can use VCI as you're scanning with the A-plane, which gives you a nice view of bones, for example. VCI is really good for bones. But I think it's more practical to use the VCI-C. We use the C-plane of the VCI. Look at this fetal spine. You don't see much information from this sagittal view of the fetal spine. And this is a 4D. I just put an image here. And we can ask the machine to give us the information that's perpendicular to this line, okay? And this is the information that you get. So you get a lot of information here. You can see the spine and the ribs. Another example, this is the axial plane of the fetal brain, and the fetus is moving. If the fetus is at rest, we can acquire the volume, but when the fetus moves, and we want to demonstrate the corpus callosum, but we cannot get it from changing the position of the transducer, well, it's really fast to use the VCI-C. We just ask the machine to give us the information that is perpendicular to this line, and this line goes through the brain, through the cavum, and through the vermis here. So this is the posterior and this is the anterior aspect. And this is a pretty thin line. You can see here this slice thickness is 3.1 millimeters. And you can see the coronal plane. This is a calculated plane. You can see very nicely is the corpus callosum, the cavum, septum pellucidum, and the vermis here with the VCI-C. But you can ask the machine to give you any lines you like. You're not limited to perpendicular lines like in just 2D. Now, we can use the Omni view. This is the sagittal plane of the face, and we want to ask the machine to show us the fetal palate. So we draw a line along the hard palate. So you can get it here. This is the hard palate. But the soft palate has different angle. So we can draw another line to see the soft palate, as you can see here. And another line to look at the mandible, because they have different angles. Another option is to use the Omni view with a curved line, and you can draw a curved line along the whole palate. So you have the hard and the soft palate, and you can see both here, the hard palate and the soft palate in one image. So what we have learned? We learned how to look at the multiplanar images and to understand what we see. We learn how to rotate the images on the X, Y, and Z axis. We learned the tool of movement of the dot of interest, and we use the tools to straighten the volume. Then we talked about the importance of the spatial location. We talked about tomographic imaging, looking at the images are parallel, and we can use the volume contrast imaging to all the other options that we talked before, and also to the static and dynamic examination. And what we need to do now is to practice, because practice makes perfect.